You have probably been told over and over again that losing your sight with age is simply a fact of life, something inevitable like gray hair or joint pain. You have been told it is normal, it is natural, and that the best thing you can do is accept the situation, book an appointment with your optician, get a stronger prescription, and move on. But here is a truth that very few professionals take the time to sit down and explain to you clearly, without medical jargon, looking you straight in the eye. No, it is not always simply a matter of getting older. The medical community is clear about this. Once you are past 60, your eyes become significantly more fragile. Conditions like dry eyes, cataracts, macular degeneration, or even sudden blurry vision in just one eye become far more common, and health authorities have warned about an alarming rise in vision loss among adults at a rate never seen before in modern medical history. What makes this situation particularly dangerous is that the deepest damage very often happens while you are asleep. At night, at the precise moment when your body is supposed to be regenerating and recovering, your retina, that incredibly light-sensitive tissue lining the back of your eye, does not always receive the oxygen and nutrients it desperately needs. The photoreceptors, those delicate specialized cells that allow you to see clearly, begin to break down slowly, silently, and most people do not notice it until the damage is already deeply established. You wake up with dry, irritated eyes. You squint to read a menu on the other side of the room. Headlights at night blind you in a way that never used to happen. You grip the steering wheel a little tighter than before, and somewhere in the back of your mind, a quiet voice tells you it is just old age. But that is not always the whole story. A study published in a leading ophthalmology journal in 2023 confirmed what many researchers had been observing for years. Age-related retinal damage often begins with silent changes deep inside the eye tissue. Oxidative stress, chronic low-grade inflammation, and these processes are most active at night, precisely when your eyes should be doing their deepest repair work. But here is the genuinely exciting part, and this is really what I want you to take away from everything I'm about to share. More recent research has uncovered something remarkable. Certain everyday fruits contain powerful natural compounds that your eyes are literally craving during sleep. These nutrients can support the regeneration of damaged photoreceptor cells, improve circulation to the retina, and even slow the progression of macular degeneration, which remains the leading cause of central vision loss in adults over 60. In other words, you may be able to support clearer vision naturally and safely without reaching for another prescription bottle, without booking another surgical consultation, and all while you sleep. 1. Fruit number 7 and number 6 that you are not using the right way. Let us start with kiwi. Small, slightly fuzzy, you probably walk right past it at the grocery store every single week. Yet for aging eyes, kiwi is genuinely impressive, and the scientific research backs that up firmly. Here is why it matters. As we age, the retina becomes increasingly vulnerable to oxidative stress. The cells gradually wear down, and before you even realize it, you are squinting at road signs. Headlights look like exploding starbursts when you drive at night, or you wake up every morning with vision that takes a full hour to become clear. That is not simply aging, that is cellular damage, and there is growing evidence that it is at least partially addressable. Kiwi is loaded with two nutrients that eye health researchers keep coming back to again and again: lutein and zeaxanthin. Think of them as natural internal filters. They sit inside the layers of your retina, absorbing harmful blue light and providing antioxidant protection while your eyes go through their nighttime repair process. On top of that, kiwi contains a unique combination of antioxidants and a small amount of serotonin, which promotes deeper, more restorative sleep. And deep sleep is precisely when your eyes do their most important repair work. These two things are far more connected than most people ever realize. A study published in the Journal of Nutrition and Healthy Aging found that older adults who consumed 2 golden kiwis daily experienced measurable improvements in visual sharpness, along with reduced morning dryness and eye redness. 2 pieces of fruit per day, measurable results. How do you use it correctly? Eat 2 golden kiwis, not the green ones, about 1 hour before going to bed. Golden kiwis contain more lutein, produce less acidity, and sit much easier on the stomach late in the evening, which matters when you are trying to get quality sleep. And here is a detail that most people completely overlook. Do not peel all the way to the edge. That thin layer of flesh right beneath the skin contains concentrated caffeic acid, a potent antioxidant. Simply scoop the fruit out with a spoon and leave that inner edge intact. Now let us move on to watermelon, which you probably already love. If you have ever wondered why your vision is still blurry an hour after waking up, you will want to pay attention to this. As we age, the eyes dry out faster. Blood flow to the retina gradually slows down, and that reduced circulation is a major contributor to the frustrating morning blurriness that sometimes takes hours to clear, if it clears at all. Watermelon is over 90% water, so the hydration benefit is obvious, but the research points to something deeper. Watermelon is one of the richest dietary sources of lycopene, a powerful carotenoid antioxidant that has been linked in observational studies to reduced oxidative damage in retinal cells and potential protective effects against age-related conditions, including cataracts and macular degeneration. How do you use it? Enjoy 1 to 2 cups of chilled, seedless watermelon about 30 minutes before bed. Skip the added salt. Sodium can raise intraocular pressure, which has been identified as a significant risk factor for vision loss. And do not throw away the white rind. It contains citrulline, an amino acid that supports healthy blood vessel function and may contribute to nighttime eye nourishment. 2. Black currants and wild blueberries. 2 allies you are completely underestimating. At number 5, here's a fruit that most people have genuinely never bought. Black currants. Tiny, deep purple, easy to overlook. But when it comes to protecting your eyes, especially in low light conditions, black currants are quietly remarkable. The specific problem they address is retinal microinflammation and reduced blood flow to the optic nerve. Over time, that chronic low-grade inflammation blurs your vision, creates halos around headlights at night, and causes progressive eye strain in dim conditions. These are problems that a stronger glasses prescription simply cannot fix. What makes black currants so effective is their extraordinary anthocyanin content, those deep pigments that give the berries their distinctive color. Inside the eye, these compounds work on several levels simultaneously. They calm inflammation, support the dilation of blood vessels, and help restore rhodopsin, the visual pigment responsible for your eye's ability to adjust from bright light to darkness. A randomized placebo-controlled clinical trial involving glaucoma patients found that 50 milligrams of black currant anthocyanins daily over 24 months significantly improved blood flow to the optic nerve head and retinal areas, and meaningfully slowed the progression of visual field loss compared to the placebo group. That is not a small finding. How do you use them? Fresh black currants are hard to find in most grocery stores. Look for a standardized black currant anthocyanin extract, around 50 milligrams daily, taken in the evening alongside your other fruits. For better absorption, pair it with a small amount of healthy fat like a few walnuts, or a source of vitamin C like a slice of orange. At number 4, we have wild blueberries, which you probably already have at home. But here is what surprises most people. The majority of us eat blueberries in a way that actually cancels out a significant portion of their eye protective benefits. What blueberries target is oxidative damage in your photoreceptors, those specialized cells in your retina that allow you to focus, distinguish fine detail, and adapt to changes in light. The key compound in blueberries is pterostilbene, chemically related to resveratrol, but significantly more bioavailable. Research suggests it can cross the blood-retinal barrier and act directly on DNA damage in light-sensitive cells. A 2023 study found that older adults who consumed wild blueberries daily for 12 weeks showed notable improvements in visual acuity and reported meaningfully less eye strain when viewing digital screens in low light. Here's the critical detail. Not all blueberries deliver the same benefit. The large, shiny, cultivated varieties commonly sold in supermarkets have measurably lower antioxidant density compared to small wild blueberries, typically found in the frozen section, which carry nearly double the concentration of active compounds. And frozen is just as effective as fresh. How do you use them correctly? About 1/3 of a cup of wild blueberries 45 minutes before bed. And most importantly, do not combine them with dairy products. The proteins in milk bind to anthocyanins and physically block their absorption in the gut. Lightly freeze your blueberries and then thaw them before eating. That process breaks down cell walls and dramatically increases the bioavailability of the antioxidants. 3. Dragon fruit and goji berries, the two biggest surprises on this list. At number 3, here is one that surprises almost everybody. Dragon fruit. Exotic, visually striking, deep red on the inside, and research suggests it may be one of the most effective fruits for increasing oxygen delivery to your eyes during sleep. If you regularly wake up with tired, heavy eyes, even after a full night of rest, this one deserves your close attention. But the variety matters enormously here. You want the deep red flesh. The white-fleshed varieties simply do not contain what we are looking for. The specific problem dragon fruit addresses is retinal hypoxia. That is when your retinal tissue is not receiving adequate oxygen during sleep. When that happens, you can sleep a full 8 hours and still wake up with fatigued, heavy eyes. Your peripheral vision starts to blur. Colors look flatter than they used to. Red dragon fruit is rich in betalains, a class of antioxidants that research shows can support nitric oxide production in blood vessels. Nitric oxide is the molecule that relaxes and widens capillaries, including the tiny ones that supply your retina. Wider capillaries mean more oxygen and more nutrients reaching retinal tissue during deep sleep. How do you use it? Half a red-fleshed dragon fruit about 1 hour before bed. And here's the detail almost everyone misses. Do not swallow the black seeds whole. Chew them. Those seeds contain omega-3 fatty acids and magnesium, both of which play documented roles in retinal nerve health and repair. Swallowed whole, you lose almost all of that benefit. At number 2, a fruit with thousands of years of history behind it, goji berries. Bright red, slightly sweet, used in traditional medicine for over 2,000 years, specifically for eye health. And now the clinical evidence is beginning to line up. The exact problem they target is macular thinning. The macula is the central zone of your retina. It is responsible for the sharp, detailed vision you use to read, recognize faces, and see color with clarity. As we age, oxidative stress and reduced circulation gradually degrade this tissue. That is the foundational process behind age-related macular degeneration. What makes goji berries exceptional is their zeaxanthin content. Goji berries are among the highest natural dietary sources of zeaxanthin on the planet. A 2021 study published in a peer-reviewed nutrition journal followed adults aged 60 to 80 who consumed dried goji berries 5 days a week for 90 days. The results showed a significant increase in macular pigment optical density, which is a direct measure of macular protection. And no participant in the study showed further progression of macular degeneration during the trial period. How do you use them? Soak 2 tablespoons of dried goji berries in warm water for about 10 minutes. Then eat them roughly 30 minutes before going to bed. And pair your goji berries with a small square of high-quality dark chocolate, at least 85% cacao. The flavonoids in cocoa have been shown to enhance the absorption of zeaxanthin. Together, they create a synergy your macula can genuinely use. 4. Papaya, the number 1 fruit, and the 5 rules you must never ignore. And finally, at number 1, the fruit that tops this entire list for the health of your eyes. Papaya. It is not exotic. It is not expensive. You may actually have one sitting on your kitchen counter right now, but when you eat it correctly, it targets one of the most destructive and most overlooked processes behind blurry vision, cloudy lenses, and early cataract formation. The specific enemy papaya goes after is glycation. That is the process by which excess blood glucose binds to proteins in your eye tissue, forming advanced glycation end products, compounds that progressively cloud your lens and degrade your retina. Glycation is one of the most underappreciated contributors to age-related vision deterioration, and it is happening silently and continuously in most people over 60. Papaya is rich in papain, a naturally occurring enzyme with well-documented anti-inflammatory and protein-modifying properties. It also delivers a powerful combination of vitamins A, C, and E alongside folate. nutrients that research consistently links to tear film stability, retinal protection, and reduced oxidative stress inside the eye. A 2023 study in clinical gerontology found that older adults who consume papaya in the evening showed lower levels of glycation markers in follow-up testing, along with stronger tear production and measurable improvements in contrast vision within just 6 weeks. How do you use it? 1 cup of ripe papaya cubes about 1 hour before going to bed. Two things matter here. Fresh is better than processed, and room temperature is better than cold. Take your papaya out of the refrigerator at least 30 to 60 minutes before eating it. Cold temperatures suppress enzyme activity, and you want papain at full strength when it reaches your digestive system. Do not pair it with dairy products either, for the same absorption-blocking reason we discussed with blueberries. Squeeze fresh lime juice over your papaya before eating. The vitamin C in the lime significantly boosts your body's absorption of vitamin A, giving your eyes more of exactly what they need. Now, before we wrap up, here are 5 essential rules you absolutely need to know, because without them you could eat every single fruit on this list and still not receive the full benefit. Rule number 1, do not combine these fruits with high calcium foods. If you eat your papaya or blueberries shortly after milk, yogurt, or calcium-fortified cereals, you are actively blocking your body's absorption of lutein and zeaxanthin. Give yourself at least 90 minutes between dairy and your fruit. Rule number 2, always add a small amount of healthy fat. Most of the key nutrients in these fruits are fat-soluble. Your body simply cannot absorb them fully without fat present. A few walnuts, a teaspoon of flaxseed oil, or a few slices of avocado can boost absorption by more than 50%, according to published research. Same food, dramatically better delivery to your eyes. Rule number 3, wash gently. Aggressive scrubbing under hard running water removes a significant portion of the surface antioxidants, particularly on blueberries and black currants, where the protective compounds are concentrated in and near the skin. Rinse gently under cool water, pat dry, and wash right before eating, not hours in advance. Rule number 4, choose room temperature over cold. Refrigeration suppresses enzyme activity in several of these fruits, most notably papain in papaya. Take your fruit out 30 to 60 minutes before eating and let it come to room temperature so that your body can extract the maximum possible benefit. Rule number 5, timing is everything. Eat your fruit 60 to 90 minutes before going to bed. Too early, and the nutrients are metabolized and cleared before your eyes enter their primary repair window. Too late, and active digestion disrupts the deep sleep your eyes need to actually do the work. Blurry vision is not simply an inevitable consequence of aging. It is very often the result of specific, identifiable processes occurring in your eye tissue: oxidative damage, inflammation, poor circulation, glycation. And the growing body of evidence suggests that certain fruits, eaten at the right time and in the right way, can meaningfully support your eye's natural overnight repair processes. Think about reading without squinting, driving at night without that anxious grip on the steering wheel, waking up in the morning and actually seeing clearly within minutes, looking at the people you love and seeing every single detail. That is what this is really about. Not just clearer vision, but your independence, your confidence, and your overall quality of life.